Hello, I'm Dr. Rafel. I'm a Central Illinois chiropractor at Eastside Wellness, and we're here to go over mobilization for the front part of your hip. Super common, being blamed as maybe one of the chief reasons for causing spinal stenosis. And as we age, we're going to see this in a huge part of our population, and the number one reason is we spend so much time shortening it through sitting. So I want to go over a great way to help mobilize. First thing we're going to do is hold on so our brain feels safe to give us more range by holding on to the doorway. And in this case, I'm going to mobilize the right anterior hip. The hip that's down is the one I'm working on, and it's going to be slightly toed in. I don't want the toe to start to go neutral or toe out. That's a way it kind of, the joint gets taken off the hook, and I want to keep it on the hook by keeping it toed in. First thing I'm going to do is hold on to the door frame, and I'm going to drive my pelvis forward as I do that. And I want to kind of keep my back backward. I don't want to let my chest move forward, or again, I'm letting that hip off the hook, okay? So I'm going to drive forward. Then I'm going to go, and I would say somewhere between 3 and 5 reps, people always want to know. I'm going to grip with 2 hands over here and drive it again. So now I'm going to do more of that outer anterior hip. 3 to 5 reps, driving through. If you feel your heel leave, then you're beyond where you should go. You should be able to keep your heel flat through this. And again, now you're going to grab a hold, and now I'm going to do more of the inside anterior hip. Okay, then I want to do what I call a frontal plane anterior hip. So I'm going to put right hand low, left hand high, and I'm going to push my pelvis a little offline, in this case toward the left, and I'm going to drive my pelvis forward again. Again, 3 to 5 reps. Then I'm going to come across, same thing, and I'm going to hold on, left hand low, right hand high, and I'm making sure that foot is still toed in. I'm going to drive in this position. When I am tipped, like I am now, to the left and my right side is down, I want to do a thing called circle the wagons. I'm going to rotate both clockwise and counterclockwise to help open up that hip. I find this is a fantastic way to get mobility back into this hip joint. And making sure to try to get as far and deep around that circle as you can get. Go slow. You can always start off small at first, but our goal is to get bigger and bigger on those circumductions. Then the last plane of motion is where I am going to hold probably a little bit higher, and I'm going to hip check right and left. As I slowly bend this knee, I'm bringing my hip forward an inch at a time. And then I'm going to hit a certain point where I'm going to still be able to go this way, but I'm going to restrict. And right there, I can't get out into my lateral hip anymore. That's too far. I'm going to back it up. There's my full range, but I'm right on the edge of it. That's right where I want to work this. And here I'd work maybe a little more, 6 to 8 reps. Thanks.